Derek, thank you everyone for joining on the call. I apologize for the delay. I want to thank the members of our team that are on the call, thank them for the work that they're doing, and thank all the members of the media again for getting the message out about COVID-19 and what is happening on the ground here. I spoke yesterday as we begin the month of April about the challenges that are ahead and the tough times that we still have to go through as we fight this virus. And again, we will get through this. There's no doubt about it. There are significant challenges, but we will get through this at the end of the day. But I wanted to talk a little bit about what is happening right now in our hospitals and with our healthcare system. And what we've been talking about this entire time is obviously working to address this public health crisis in a way that will ultimately reduce the number of people who will die as a result of this virus. The other important element here, and related, of course, is the fact that this virus and the surge in patients that it will cause will have this impact on our healthcare system and our hospital system. And we want to make sure that we do everything we can to prevent it from overwhelming that system. And that's why all of these things that we're doing are happening. But I wanted to talk about what's happening inside those hospitals and what those healthcare workers who are on the front lines are experiencing right now. They are operating in an incredibly difficult, stressful, traumatic environment in which they are working overtime, double shifts, day after day after day, in a struggle to save people's lives. And it is incredibly stressful. It is emotional. It is extraordinarily difficult. I was on a call yesterday on the radio with County Executive Curran. We were doing an interview and we got a call from a person named Abby. I wasn't sure, I didn't catch, she's a healthcare worker. I didn't catch if she was a doctor or a nurse, but I think Newsday has reported that she was a physician. And she was talking about her experience in the hospital, and you could hear the emotion in her voice and the anguish in her voice, talking about her patients, what they're dealing with, the fact that we need more ventilators here, the fact that they are thinking about everything they have to do to save people's lives. And that is coming at them every second of every day in those hospitals right now. And that surge is still building. We see it in the numbers. But I think Abby's voice and what I heard yesterday is really representative of the voices of healthcare workers here in the system and those who are dealing with it around our region and state and other parts of the country as well. I know people, my wife Tracy and I, we have friends, personal friends who are working in hospitals now, and we hear those stories directly. And I know that many of you have loved ones who are working in hospitals right now. You have friends and family and people you care about who are working in hospitals. And what we know is that these individuals right now are there. They are fighting to save people's lives. And while they are doing that, they are also in the back of their mind thinking about their own safety and the risk that they're taking for their own health. And even more importantly, we know they're thinking about what are they doing and what are they risking in terms of their family's health. That's the position that they're in right now. And I wanted to talk about that a little bit because, one, I want people to understand what is happening and why we're doing everything we're doing in as real a way as you can get. But I know that so many people out there know these stories, have heard these stories, and have personal experience with loved ones and friends and neighbors who are going through this. And I would urge you to continue to share those stories, to talk about what is going on, because it again emphasizes the point and the importance, and I would ask people to share this as well, of why we're doing social distancing, of why whole parts of our economy have been shut down, why we are isolating at home if we are sick and staying at home in any case as much as we can and remaining distant from one another. Why all these changes that have occurred? Why? It is because of what's happening in our hospitals right now. It's because of the numbers that we hear every day about people who've died from COVID-19. That's why we're doing what we're doing. We will get through this, but we need to get through it together. We will get through it together, and we need everybody to honor the work that's happening right now and the fight that's going on in our hospitals and in the healthcare system to save people's lives. And to do that by following the health department guidance, by following the recommendations of the healthcare professionals and that we are putting out and that the media is putting out about all of these practices. And I urge you to continue to share those stories and get the message out. Let's talk about the numbers. Of course, they continue to go up. We've talked about this every day. The testing goes up every day. The numbers go up every day. We've tested more than 21,000 people in Suffolk County now. And the numbers for the first time we have seen in a 24-hour period a more than 1,000 person increase in the number of positive cases. So we're up to 8,000, as reported by the governor, 8,746. That's an increase over yesterday of 1,141 cases. So again, the trajectory of this, first time seeing more than a 1,000 person increase in positive cases. That is a direct reflection of the amount of testing we are doing. But again, it's a significant number, I think, to point out. Speaking about the numbers, the map that you see behind me is our COVID-19 map. We've had this in development. We had this up for a period, and our IT team has been working day and night to get this up and running. This map details the location of confirmed cases across the county by providing a town by town and hamlet by hamlet breakdown of positive confirmed cases. Now, I've been speaking and our team has been speaking with our town supervisors and our village mayors every day, and I thank them for the work that they're doing on the ground. And this has been an important element. We know that it's something they have been looking for and the public has been looking for. And I'm really grateful to our IT team that they've been able to automate this process and in real time now be able to update these numbers for the public to see. And if you want to see those numbers at any point, you can go to our website, suffolkcounty.ny.gov/COVID-19. In terms of the hospitalizations, we are now at 1,054 COVID-19 hospitalizations. Significant again, this is the first time we have crossed 1,000 people who are hospitalized with COVID-19. We saw a daily increase of 157 in that number, but again, we've crossed that 1,000 threshold of people hospitalized. And every day we continue to see an increase in the hospitalizations for COVID-19 patients. On the ICU beds, which we are focused on, obviously, because these are the patients who are most sick and most at risk, and where we need that specialized equipment, ventilators. We have now 314. That's up from 272 people on ICU beds yesterday, another 42 who are on ICU units, in ICU beds, I should say. Capacity. The hospital capacity continues to increase. We have another 57 beds added from yesterday. We're up to 2,881. The ICU beds increased as well. We're up to 438 beds. That's an increase of 23 beds. And as of last night, there were a total of 472 hospital beds that were vacant or empty and 64 ICU beds that were available. The hospital capacity, again, we've been talking about this a lot. The hospital capacity is, if you think about what's happening right now to our hospital system, the governor put in a mandate for hospitals to increase capacity by 50%. 50% increase of capacity with a goal of 100%. And if you think about that, what we're talking about doing in a matter of weeks is essentially creating a new hospital system on top of the existing hospital system. That is a Herculean effort by any stretch of the imagination. But that is what is happening right now. We are working to basically work with the state's leadership and working with our hospitals, double the amount of beds in this state. That is what is being done right now to meet this challenge. And that's being done in a matter of weeks. So every day we've seen the number of hospital beds that exist in this county rise, and we're going to continue to see the number rise as more and more beds come online in these new hospitals like at Stony Brook University with the Army Corps of Engineer get built. Yesterday, during our last update, I again was in the unfortunate position of having to confirm additional deaths in Suffolk County. The number had risen to 69 fatalities related to COVID-19 yesterday. That number has now risen to 84, an increase of an additional 15 fatalities. The age range of those patients is from 40s to late 80s, and most of those individuals died at a local hospital. If you are looking for more detailed information, we're providing that at suffolkcounty.ny.gov/COVID-19. You can find that additional information. But again, we want to say to all of those families who have been impacted by COVID-19, the families who have lost loved ones to this virus, we're so sorry for your loss. We're thinking about you. We're praying for you as we continue to pray for all of those who are in the hospital and fighting this virus right now. We've also spent a lot of time talking about the struggles of local businesses and our small businesses. Of course, we know we are focused on the public health crisis here, but there is a crisis in our economy. There is a crisis that our small businesses face, and we must focus on that and deal with that even while we focus on the public health aspect of this crisis. 2 weeks ago, we launched our business response unit, led by our Department of Economic Development and Department of Labor, to serve as a one-stop shop for our businesses that are in need. We immediately stood up a comprehensive webpage to provide guidance, set up a dedicated call center to field questions, 311, Suffolk 311. And we launched a survey to gather information regarding business operations and the impacts on our workforce. And on March 31st, at this time, I can tell you by that date, we'd received more than 1,200 responses from businesses that employ more than 13,700 individuals.